Good morning, friends. Welcome to our next learning session. And today I am going to talk about altogether different disease. I have been talking about heart and lung diseases till this time, and now today I have chosen a disease which we call infectious diseases. This disease is called gonorrhea and caused by a bacteria called gonococcus. But before I go into details, I must tell you that the audience has given me the feedback that I should only speak in English, because speaking English and then Hindi does not let them concentrate on it, and when the link is broken they lose interest and the video also becomes very lengthy. So to make the video short and to make all of you understand, I will only speak in English. I may stress things twice, thrice, just to make you understand. Now, what is gonorrhea? Gonorrhea is a disease of the urogenital tract of the male as well as female. Urogenital, what does it mean? It means urinary and genital tract. In the male, the urogenital tract is connected with the penis, and in the female it is the vagina for the genital tract and urethra for the urinary tract. This is the urethra is the opening outside just above the vaginal opening, and in the male it is the common path coming through the penis, but there is a control mechanism there. When you pass urine, the other areas are closed, and when the other areas are coming out, the urinary system keeps shut up. Now, what is this? What happens if a person has got this disease and he has sex with a healthy female? The female will become infected, and it is vice versa. If the female has disease and the man does intercourse, he will get the disease. Therefore, when we treat, both partners should be treated. Friends, this was 1976, early part, my beginning in private practice. A very influential, a rich, very rich person came to me to discuss about a case. He asked me the treatment of gonorrhea, and I told him that this is how we treat gonorrhea. Give 6 tablets, 6 capsules of ampicillin 500 mg, lump sum as single dose. He was surprised. He had shown it the patient at the All India Medical Sciences, and they have prescribed as usual 1 capsule 3 times daily or 2 capsules 3 times daily, this type of treatment. The patient's culture for urinary tract infection, that is in this case the gonorrhea, was positive. And let me here tell you what is gonorrhea. Gonorrhea is a disease, as I said, of the urogenital tract of both male and females. It is caused by a bacteria called Neisseria gonorrhoeae. Neisseria gonorrhoeae. This name is a little difficult, but you can remember only gonococcus. What are cocci? Cocci are round spherical organism. All bacteria rounded spherical. They are called cocci for plural and coccus for single. Coccus we write COCCUS, and cocci we write COCCI. So these, then there is another group of organisms which are rod shaped. These are called for single bacillus, and for many we use bacilli. BACILLI. Bacilli is many rod shaped bacteria, and BACILLUS, bacillus is a single rod shaped bacteria. Then we divide these bacteria. I said one division is the spherical and rod shaped, that is the cocci versus bacilli. The other is by staining them with Gram's stain. When we stain, I will not go into details of the Gram stain, but when we stain it with the Gram stain, either they become purplish or they become pink. If they remain purplish, then we call them Gram positive, and if they become pink, then we say they are Gram negative. So the bacteria we are referring to is the Neisseria gonorrhoeae, technical name. Medical name is Neisseria gonorrhoeae, and whereas the common name is Gonococcus. So this Gonococcus is Gram negative, which means after Gram stain it appears pink in the smear when the pathologist sees it, and it is spherical, so that is why it is called coccus. Gonococcus name comes from the spherical and pinkish bacteria which lodge in the urinary and genital tract. So when this patient which was brought to me at least about which I was being asked, I gave 6 capsules of ampicillin lump sum and asked for culture after 2 days, which turned out to be negative. Then I said, if there are no symptoms, repeat culture after 6 weeks, after 3 weeks. Then 3 weeks again it was negative. Then next time I asked for after 6 weeks, still this was negative. So patient was convinced that the lady has been cured and the problem is solved out. Now the textbook treatment of gonorrhea is described like this, that give a large dose. It is like bombarding a small area with large amount of ammunition, rather than keep firing every day. Here we did was we gave a large dose lump sum and the patient was cured. So friends, this was very interesting case, but I want to show you here something. Now this is, look at this diagram. You see, this is pinkish, this is purplish. These are the Gram positive bacteria and these are the Gram negative bacteria. Our Gonococcus comes in this category. Gonococcus comes in this category. This will look pinkish in the stain, and the bacteria which are Gram positive, they will look like this, purplish in the stain. See a larger view, like we see, you can read it also. Stop your video at this place and read it out. These are all pinkish, not purplish, they are pinkish, and that is what it shows, that and these are all spherical. There are no rods in this picture. There are no rods. They are all some small spheres, some are large spheres, but they are all spherical, rounded structures, and they are pinkish. Therefore, we call them Gram negative cocci. Just to get a little more idea about it, look at this diagram. This is single Gonococcus taken, and this is how it looks, the Gonococcus. Okay, so today you have learnt the disease called gonorrhea. It is also called sexually transmitted disease, STD. Common term doctors write is STD, which means sexually transmitted disease. Sometimes these are also called sexually transmitted infections, STI. People also write STI, means sexually transmitted infections. Why we call them sexually transmitted? Because they spread due to intercourse between an infected person and a normal person. It doesn't matter whether it is a male infected or female infected. If the female is infected, and this happens in society, male going to the some call card and she having the problem due to many reasons which I will not go into detail. It is not disclosed, and this man becomes infected. When he goes to some other female, he passes infection to her. Similarly, if the female has been infected, she passes the infection to whosoever male comes to her for intercourse. So this is how it spreads, and that is what the treatment should be given. I was lucky that even at being in beginner in the practice, I could fully treat this patient. This rewarded me in many ways, because this person, who was, as I said, was very rich at that time, he became my permanent patient. I was his counselor for all other problems related to medical field, and this process continued for the next about 15 years till he died due to some of his own problems. So friends, thank you very much. I hope you will continue with your comments and suggestions, but please give these suggestions and comments on the videos. I don't mind your comments. Even you can criticize me, but in a sophisticated language, okay? But I am doing this thing not for any money or for any monetary gain. I am doing it only for spreading medical knowledge. You know, all of you know that I've been writing blogs for the same purpose, and now I am doing one-to-one action, so that you can hear and I can hear, explain and stress one thing again and again. Thank you very much. Next time we will take up another topic.